Hi, everyone. My name is Ijong Kim, and I'm a postdoctoral scholar at Texas Aging and Longevity Center. I have the great pleasure of introducing Dr. Kira Birditt as today's speaker. Dr. Birditt is a research associate professor at the Survey Research Center and the director of the Aging and Biopsychosocial Innovations Program, both at the University of Michigan Institute for Social Research. Over time. Dr. Birditt has authored over 100 journal articles and book chapters, and she has been recognized numerous times for her scholarship, including the 2019 Richard Kalish Innovative Publication Award from the Gerontological Society of America for her article, Stress and Negative Relationship Quality Among Older Couples, Implications for Blood Pressure. Dr. Birditt is also principal investigator on multiple nationally funded research projects and serves as an NIH panel member on social personality and interpersonal processes. We are privileged today to hear Dr. Birditt speak on the topic of today's talk, stress and health in context, the role of close social ties. Please join me in welcoming Dr. Kira Birditt.
Thank you so much for that wonderful introduction. That was wonderful. And thank you guys so much for inviting me to speak today. I'm really happy to talk about some of the research. I'll talk about some previous studies as well as some new things that we're working on. So just to give you an overview of what I'll be talking about today, first I'll talk about why we study social relationships, and then I'll talk about what we mean by negative aspects of relationships and how it varies by time and by relationship type. And then I'll talk about the implications of negative aspects of relationships for well-being and the in that association, research we're doing and how social ties might play a part in racial health disparities. And finally, we're doing some new research on social ties and well-being in the context of the COVID-19 pandemic. And I'll talk a little bit about the findings that we have in that area. So first of all, as many of you may have seen this before, this is a meta-analysis of the research on social relationships and the implications for mortality. And she compared social ties with many other things you might think of as important for health, including health behaviors. And social relationships are more important for mortality than many other things you might think of as important, including things like cigarette smoking, alcohol consumption, and BMI, for instance. And the other important finding in this study was that she found that the quality of social relationships is even more important than whether people have social relationships in terms of the number. Focused on social support versus support. But this type of research assumes that relationships are uniformly positive. And my program of research focuses on the negative aspects of relationships. And that can be many different things that involve negativity, including daily irritations and tensions in relationships, as well as our overall feelings about relationships in terms of whether they make too many demands, for instance, or are critical of us, let us down. And it's not simply the opposite of positive aspects of relationships. And this is one of the Karen's important findings early when I was her PhD student. We found that close relationships are often very negative, and the closer the relationship is, often the more negative it is. And this is referred to often as ambivalence. So, and the most ambivalent relationships are people like the spouse, children, parents, and siblings. So they're irritating. And research that we've done on daily experiences shows that interpersonal tensions are a more common source of daily stress than other types of stress, including things like work stress, home stress, and network stress. And this is the stresses experienced by others. People experience this most often in daily life. And the research on the implications for health often shows that negative aspects of relationships are more important for positive aspects. Negativity in relationships is associated with increased allostatic load, hypertension, stroke-related mortality, coronary events, and obesity. And we often use this, what we refer to as a biopsychosocial model of negative relations and health. And this is sort of a combination of different models in the literature as a way of understanding negative aspects of relationships and stress and how that impacts health. And according to this model, 6 like age and relationship types affect the negative relationship quality and stress. And then all of those factors together affect short-term stress reactivity. And we look at stress reactivity in many different ways. One way is with biological indicators, including indicators of the cardiovascular system and stress hormones. We often look at behaviors, and this is things like coping behaviors in relationships. Another impact is the psychological implications of relationships, and that's often negative affect and positive affect. And all of these factors together affect our overall health and mortality. And another important part of this is that you can see the arrow going to the line between stress and short-term stress reactivity. We often look at how negative aspects of relationships and stress interact to impact short-term stress reactivity. And I'll talk more about that in this talk. But one of the things that we're always trying to resolve in our program of research is how can it be good to have close relationships that are negative and bad for you? And we wondered, is it that close relationships are always negative once they're negative? And finally, and also, is negativity always bad for your health? So first I'll talk about whether close relationships are always negative. Enduring dynamics, so that once you have a negative relationship, you're sort of doomed and you always have negativity in your relationship, either because you perceive people in a negative way, or it's just that dynamic is reinforcing and gets more negative over time. And the second theoretical perspective is that negative aspects of relationships text. And one of the theories that we use most, and Charles developed this model, and I'm sure many of you have heard of it, but it shows that age is associated often with better well-being and less negativity and less stress, except when conflict and stress cannot be avoided. So we'll find all these age-related improvements, but in the context of things like chronic stress, we don't see those same age-related improvements. So these findings I'll talk about. Basically, we use all different data sets to assess relationships and health. And in these next findings, I'll talk about the research we've done on the social relations and health study. And this is a Detroit area study that was conducted by Tony Antonucci, and it has 3 waves in 1992, 2005, and 2015. And a particularly important part of this sample is that they were across the lifespan in wave 1. So they ranged in age from 20 to 93 in wave 1. And in wave 3, we included what we called the monthly survey. So we had 12 months of monthly surveys in which we asked people to report on the negative aspects of their relationships every month. So we have this longitudinal 3-wave data as well as monthly data on negativity in relationships. This first finding, we conducted research on the first 2 waves. This is when I first started. I was a postdoc in Tony's lab and then stayed there for a long time, and we had so much fun doing analyses of these data. This is the analysis of how much people got on their nerves and made too many demands in wave 1 and wave 2. And we found that negativity in relationships changes over time and by relationship type. With relationships with children, friends, and father decline over time, meaning negative over time. And so this shows that it's really important to look at the context of negativity in terms of the type of relationship and over time. And one of the other interesting and funny things to me is that we did an additional analysis of the spousal tie, and we wondered whether if you got a new spouse between wave 1 and wave 2, if that changed your feelings of negativity, and it did. So if you stayed with the same person, you get more negative over time. There's actually an increase in negativity, but if you with a different person between wave 1 and wave 2, there's a decline in negativity over time. So this next analysis of these data, this is of the monthly data, and this is just to show how much variability there is in the negative aspects of relationships, with even in the same relationships, both within people and between people over time. So this is a pretty crazy graph but each line is a person, and on the x-axis, each journal is a month. And this is how they feel about their closest relationship in their convoy diagram. So this is the person that they can't imagine life without. And it's most often the spousal tie, but it also could be a child, parent, and other relationships. And you can see there that there's lots of within person variability, even within a year, as well as between person variance. And here's just some example piece, and this person feels pretty negative about their first person in their network over time, but there's the person on the right has a lot of variability in their negativity, with starting out really irritated and getting a little bit less irritated, but then ending just as irritated as they were before. So there's lots of variance. And so in the next question that we wondered is, are there age differences will feel about closest relationships in terms of negativity, depending on the closeness of the relationship. So this is on the x-axis, CNM1 is their closest relationship, CNM2 is their second closest, and CNM3 is their third closest. And we found that people report less negativity in their relationships with age, but not in their closest tie. So we think this is consistent with the strength and vulnerability integration model, which suggests that there's age-related improvements in how people feel about their relationships, unless you can't avoid them. So I think in your closest relationship, it's probably the hardest to avoid feeling negative in that relationship. So this next area of research, we've been looking at how negative aspects of relationships are associated with well-being and the role of stress in that association. And this is trying to get that are negative relationships always bad for your health? And it compares two theoretical perspectives. The one perspective is the main effects model, which suggests that negative ties should always have direct effects on health, irrespective of stress. And the second model is a stress exacerbation model, and that suggests that negative relationships are particularly important for health when people are under stress. And we often look at the context of chronic stress in this research, and this is ongoing demands that threaten to overwhelm an individual's resources. And this can be things like ongoing financial strain, ongoing work stress, or a caregiving role, for instance. And the research on stress and health shows that chronic stress tends to be more highly associated with health and well-being than acute types of stress, such as an acute life event. But the research on chronic stress has often focused on individuals, and we were interested in dyadic relationships and how chronic stress affects the dyad. These studies, we've often looked at the marital context because the marital context is the most negative, and that's our favorite topic. And that's one of the reasons. And you can also get really interesting data on how people feel about each other in the marital tie, and there's often not very much agreement. And stress is experienced dyadically in the marital tie, and a lot of research shows that there's cross-partner effects of stress on marital satisfaction, which suggests that your partner's stress affects your own marital satisfaction as much as your own feelings of stress. And interestingly, the research shows that these effects are often stronger among husbands, with the wife stress affecting husbands more strongly, and especially when there's marital conflict. So this is consistent with that stress exacerbation model, that if the wife is stressed and there's conflict, husbands are particularly harmed. In this program of research, we wondered what the implications are for biological systems, though. And biological indicators provide us unique information about stress reactivity, and they're not necessarily consistent with self-report. And it lets us look at the mechanisms that might predict health. And in these studies, we often look at the health and retirement study data, and this is data that are publicly available, and it's, I'm sure many of you have heard about it. It's adults over age 50 in the United States, and the research has been conducted every 2 years since 1992. And they included an enhanced face-to-face module starting in 2006 that included a lot of biological indicators that we have been looking at in our research. And in these studies, we wondered first, is stress associated with health among older couples? And then is the link between stress and health, does it vary by negative relationship quality? And in this first study, we looked at blood pressure, And blood pressure is really important to look at because almost 50% of Americans now have hypertension, according to the newest definition of hypertension, which is systolic of 130 or diastolic of 80 or greater. And as many of you know, hypertension is related to lots of health problems, including increased risk of heart disease, stroke, even cognitive decline, and mortality. And in this first slide, this is how stress is related to blood pressure among couples. And we found that it's partner stress that is associated with blood pressure and not one's own stress, and particularly for husbands. So when husbands had wives who reported more stress, they had higher systolic blood pressure. But there was no such association for wives. And there was also no within-person association between chronic stress and blood pressure, which we thought was really interesting. And we also looked at whether negative relationship quality predicted blood pressure, and there was an interaction. So there wasn't a main effect of negative relationship quality. Both partners in the relationship had to feel negative to have higher blood pressure, and this didn't vary by gender. And finally, consistent with that stress exacerbation model, the stress and negative marital quality interacted to predict blood pressure, but only for husbands. And husbands had higher blood pressure when they felt more negative about their relationship, and their wives were more stressed. So that's consistent with the other research on marital satisfaction. So that husbands appear particularly harmed by stress and negative relationship quality. This next study, we wondered whether we would find similar findings with waist circumference. And this is, so I didn't tell you before, but the blood pressure was an actual blood pressure cuff. And then they also added a physical measurement of waist circumference in the HRS. So this is their waist circumference in 2006 and 2010. And having more than 35 inches for women and more than 40 inches for men is considered at risk. And this sample is pretty highly at risk, with almost 70% of the wives at risk in the 2010 wave. For this finding, we looked first at whether stress was related to waist circumference. And again, we found a partner effect, but both for husbands and wives. Husbands and wives, so husbands who were more stressed had wives who had higher blood pressure. Wives who were more stressed had husbands who had, waist circumference. So it's both husbands and wives showed a partner effect, but there was no within-person association between stress and waist circumference. So it appears truly dyadic. And we found a similar finding to the blood pressure findings, with negative relationship quality exacerbating the link between stress and waist circumference for husbands, but not for wives. So husbands, again, appeared sensitive to both having wives who are more stressed and having more negative relationship quality. So in conclusion, the findings on negative relationships and health show that the effects of stress appear truly dyadic. Partner stress was more important for health outcomes than one's own stress. And husbands had higher blood pressure when wives were more stressed, and husbands and wives had higher waist circumference when partners were more stressed. And the links between stress and husbands' blood pressure was stronger in more negative marriages. And one of the explanations of this might be that husbands rely on their wives primarily for support, whereas wives have many other people often that they rely on for support. So maybe when wives are more stressed and there's more negativity, husbands are not getting the support that they need in their relationship. But we do need to do a lot more research in this area to understand these findings. Particularly, I think, looking at daily relationship interactions and how chronic stress affects daily life would help understand this more. And overall, the evidence supports the stress exacerbation model that negative aspects of relationships are particularly important when people are under stress. So this next research I'll talk about is the research we've been doing on racial health disparities and the implications of social relationships for racial health disparities. So we know that interpersonal tensions are common and have implications for blood pressure, but how can that help us understand racial disparities in hypertension? And as many of you probably already know, there's extreme racial health disparities in hypertension in the United States. This is with the older definition of high blood pressure. So it's even worse now in terms of the overall levels of hypertension, but Black Americans tend to have higher rates of hypertension than white Americans. And this hasn't changed much over time in the United States. And Black men tend to be particularly at risk for high blood pressure and the implications of high blood pressure. They show lower levels of blood pressure control, and they have higher rates of hypertensive mortality than either white Americans or Black women. And we wondered whether social relationships play a role in these health disparities. Black individuals are exposed, especially men, are exposed to more stress than white individuals across the lifespan in terms of things like chronic stress, the death of close individuals, discrimination, and racism. And Deb Emerson is a big person in this area. It's really interesting research. And Black Americans show greater cardiovascular reactivity to stress in the laboratory, and they also tend to report lower levels of lower relationship quality. And relationship quality has a larger impact on their health. But we wondered whether we see these associations in daily life so that we can look at maybe whether daily life might be a mechanism accounting for racial health disparities. And this is the stress and well-being in everyday life study. This is an R01 based on the social relations and health study where we added a component to look at racial health disparities. And the goal was to get a sample that was half Black American and half white Americans to do an intensive study of stress. And so we did a 4-day ecological momentary assessment study in which people completed mobile phone surveys and wore 2 physiological monitors to assess the heart for 4 days. I already said that, yes. And yes, and we also have a laboratory component that I won't talk about today. So, and then the 2 monitors assessed heart rate and blood pressure, but I'll talk about the research that we have done so far on the heart rate outcomes. So first we looked at are there links between social interactions and cardiovascular reactivity in daily life? And second, are there race and gender differences in the links between social interaction and cardiovascular reactivity? And this is our preliminary findings on the SWELL data. This is the association between the number of social interactions and heart rate by race and gender. So we asked people every 3 hours to say how many people they had interacted with. And we found that Black men had higher heart rate when they have more social interactions compared to any of the other groups. And we need to do a lot more analysis of this to understand why, in terms of what is it about those social interactions that might produce an increased heart rate. We have a lot of more data to analyze in terms of what's the race of those individuals, what the type of relationship. We have questions about vigilance too that we need to look at to understand this relationship. And interestingly, we found a similar finding when looking at positive interactions with Black men appearing to be better, appearing to benefit more from positive interactions than the other groups, showing a decreased heart rate when they had more positive interactions in the last 3 hours, which is also interesting. But we didn't find the same thing for negative relationships in every 3 hour period in heart rate. We don't have the same finding for that. So it appears so far in this research that social interactions and positive interactions are related to the activation of the cardiovascular system. And we thought it was really interesting that Black men showed the strongest associations between social interactions and increased heart rate and positive interactions and decreased heart rate. And this may reflect engagement or stress when experiencing social interactions, for instance. But I think it's really great that we're also finding that positive interactions tend to benefit Black men. And this is consistent with the previous research on the importance of social ties for health and racial disparities in hypertension. Okay, so this next we'll talk about the COVID-19 pandemic. I couldn't resist. I had to do some research on this because it's right up our alley in terms of looking at a chronically stressful situation and how that impacts social ties and health. And I had the opportunity to add some items to what's called the Survey of Consumers. And Karen's been collaborating with me on this project. We added items to the May and the June survey, and then we're adding items to the November and the December surveys. So we'll be able to look at changes over time. And I'll talk a little bit more about the sample. So why look at the COVID-19 pandemic? As you all know, this is an extremely stressful time for Americans who have been experiencing many stresses, including being unemployed, forced to social distance from family, worried about the effects of COVID-19 because it has high morbidity and mortality rates. And the experience of stress and social ties may vary greatly by age, depending on life circumstances and vulnerabilities. And we thought that this would be really interesting to understand. Do we find the same age differences during a pandemic as we do usually, because it's under this really stressful experience? And as I mentioned before, gerontological theories and research suggests that older adults are better able to cope with stress and experience less conflict, but not when they're under chronic stress. So maybe we won't find the same age-related improvements in these circumstances. So we wondered, first, are there age differences in COVID-19 related stress and social ties? Second, are COVID-19 stress and social ties related to psychological well-being? And then do we find evidence of that stress exacerbation model? Are the links between COVID-19 and well-being exacerbated when people have poor social ties? And this is the survey of consumers. This has been conducted every month since 1978 at the Institute for Social Research. And it's all about consumer sentiment. I mean, every single question is about finances and income and how stressed people feel about the current financial situation. So there really are no measures in there about social relationships or health or well-being. We had the opportunity to add some items, but it was really expensive to add any item. So we only were able to add 9 items. And it was really hard to decide what to ask. But so we asked really general things. So how stressed do you feel about the coronavirus? And we had 3 well-being questions. So how depressed have you felt lately? Do you feel so worried that the worst thing would happen? Dwelling on your feelings and problems to get some ideas about psychological well-being. And then we asked questions about negative relationships in terms of how much people get on your nerves, how demanding are they? And we asked a social isolation question. So how socially isolated have you felt in the last month? And this is just from the May survey results. We found age differences in how stressed people feel about COVID-19, their social isolation, and their relationship quality, with older people reporting less COVID-19, less social isolation, and less negative relationship quality. And there was no association with positive quality. So this is consistent with all the previous research that older adults tend to fare better. And interestingly, even under this stressful circumstance where they're more vulnerable to the negative implications of COVID. And next, we looked at whether there were people who feel more stressed, are more socially isolated, and have more negative relationship quality, have poorer well-being. But there was no association with positive relationship quality and well-being. And then we found stress exacerbation findings with people who had higher levels of social isolation. When they had higher feelings of COVID-19 stress, they had poor well-being, which is consistent with the stress exacerbation model. And then again, we found it for negative relationship quality, that people who had more stress related to the coronavirus and who also had more negative relationships had poorer well-being. So overall, we found that older adults experienced less COVID stress, less social isolation, and negative relationship quality compared to younger adults. And this is consistent with all of the previous research showing that these factors are all associated with poor well-being. And this is consistent with the previous research, especially the finding that there was no link between positive quality and well-being was consistent with the research showing that negativity in relationships is more important for health than positive. and that it's stronger among individuals with poorer social ties, including social isolation and negative quality. And in terms of the pandemic, we of intervention to reduce COVID-19 stress. But now that I'm saying this, Karen is writing a paper on COVID-19 stress too that I'm involved in. And I think it'll depend on the type of contact. So and we can talk about that in the question and answer period. But she's found that having phone contact doesn't tend to help people, especially if they live alone. It's all it's in-person contact, which is a little problematic since it's hard to have in-person contact during the pandemic. But it would be interesting to think about the interventions that would actually work with this group. So overall, I think some take-homes regarding negativity in close social relationships. It's really common to feel negative, so don't worry when you want to sort of kill your spouse. I mean, especially during the pandemic or your children, I don't know. It's not always harmful for your health. It tend to be particularly harmful when people are stressed. And what I think is so interesting is that it's a dyadic phenomenon. So people are affected not by their own stress, but the stresses that other people are experiencing that they feel close to. I think is what we need to do a lot more research on in terms of looking at stress from a more relationship perspective. And so we have a bunch of future directions that data that we're collecting. One of the things that I'm really excited about is looking at spousal tie in daily life and combining and looking at cardiovascular reactivity. And so we're doing a pilot study of just a real small sample to see if it's worth it and how to do it. But it's 20 couples so far, looking at ecological momentary assessments of stress and having them wear heart monitors. Both of them wearing heart monitors, and to look at how does stress in the social, in that close social tie impact the heart in the spousal tie. Another study that is on hold right now is a study of stress and cardiovascular health in the context of ADRD caregiving, it's Alzheimer's and related dementia. We have an RO1 to look at racial disparities in stress among caregivers, and the whole in person Zoom and sending people devices, but it's taking a little while to get it all ironed out. And that's what we're also testing in the small study of couples to see how do we send people these devices, and then how do you train them how to use it remotely? Because it's, you know, the devices are a little complicated to use that we use in our studies. Another thing I mentioned is that we're interested in looking at COVID-19 stress over time. We have and by race. So we have another paper where we're looking at race differences in COVID-19 stress using that survey of consumers data, because we have data from May and June that we're going to combine so that we have a better sampling of race. And so far there are race differences in COVID-19 stress, with Asian Americans actually reporting the highest levels of stress in May and June. And it'll be really interesting to collect the November and December data, because that will include a small longitudinal sample, so we can look at change over time, as well as what's happening in, so it'll be a cross-sectional sample as well too. So we'll get a whole new group of people and see how they're feeling in November and December, which might be even more stressful, it seems like, with the election and the increase in COVID. And finally, I think the end-all goal of all of this is to intervene somehow to make people feel better. And one way I think we could do it is with this cardiovascular monitors, because people, I don't think, are often aware of how stressed they feel, and it might be nice to intervene before they have the impact. So, you know, giving them mobile phones and intervening when their heart rate increases, for instance, would be my funders and my colleagues, and thank you again for inviting me to talk. And this is my very first Zoom talk, and it's really weird. Thank you.
Thank you, Kira. Thanks so much. That was fantastic. And you have such an unbelievably so impressive. So we're going to open it up for questions right now. So if anybody would like to ask a question, please just shoot a message through chat that you want to ask a question. Edwin, are you monitoring that, or is there a way to bring that in?
I have an eye on it.
Okay, you have an eye on it. Okay, or any questions then, please? Well, I will ask a question. So Kira, I'm really fascinated by this idea of interventions with cardio monitors and phone contact. So could you talk a little bit more about that, and maybe how you see that working differently from maybe disadvantaged populations, people who are less educated or have fewer resources?
So you mean like on the long term, like how would we get people to wear devices all the time? Like, or you mean just to do the study to begin with?
Yeah, just what it would look like. Like, so they're wearing these monitors and they have to have a smartphone. What does it look like, I guess?
This is like just from the seat of my pants. I mean, some of the people that I've heard talk about things like this is about smoking cessation. So as soon as they have like an urge to smoke a cigarette, there's a physiological reaction. I can't remember what it was, but then the phone dings and says, don't do it, or practice calm breathing, or I'm kidding, but it's like a way of just limiting the behavior. So I was just thinking maybe you could do that with stress and the heart, so that even I think it might be better dyadically, might be an option too. Like, so if the husband's heart rate is increasing, the wife can intervene and say, why don't you stop watching CNN, or what? No, I'm kidding. But ways that you could intervene, because more and more people are wearing Fitbits too, and the Fitbits are becoming better able to detect changes in the heart. I think it would be another way of doing it. So getting a sample of people that already have them, and then, but the only problem with that is that more middle-aged women are wearing those than men. So maybe providing incentives to men to wear them, and I don't know.
I think I need to be.
Yeah. The other thing we thought about is combining the two ideas. So, getting a sample of people that already have Fitbits and then sending Fitbits to people who don't have them, so that you have a better SES range, because you don't want to just do it with people who have them. Yeah.
Okay, so it looks like, let's see, Tamala, do you have a question? Tamala Duran?
Oh, there we go. Did I unmute?
Yes. There you go.
I really enjoyed that discussion on stress, and I was just wondering where we can go to kind of follow the work that you're doing and your new studies, because as a health coach, this is an area that we really focus in on, and it's really great when we can have studies to share with our clients too.
Current research studies and findings and things. Would that be helpful?
Yes, that's great. That's exactly what I was looking for.
Okay, great. I'll share that with Karen and Deb then.
Okay, great.
Karen?
Oh, looks like you're muted, Karen.
Kara, sorry to ask this since I've known your work forever, but I just realized when you were showing the slide from Tony's study that what you showed was that in young adulthood, on the first closest relationship, everybody was like pretty low on negative. And then you get the age difference on 2 and 3. And what I was wondering, but what happens is the older adults just stay at the same level, and on 2 and 3, the younger adults are higher. And so be not a change amongst the older adults, I mean, a little, but it's that the younger adults can regulate better in the closest tie. And for whatever reason, they can't do it in the second and third. I mean, is there something else going on that we've never thought about in terms of, sort of like when I'm teaching, sometimes I tell my students, you want to be more like older adults. If you could adopt some of their coping strategies, you'd do better. And is that what's happening on the closest tie?
Yeah, I don't know. I haven't thought about it that way, but that's really interesting.
I hadn't thought about it that way either. And we've been thinking for a long time together, you and I, so.
I'm trying to think about how maybe with the younger people too, who would their closest tie be? It'd probably mostly be their parents. So I don't know but you would think that they'd be even more negative if it was their parent.
Maybe it's a romantic partner and it fits well with your findings that when you're younger, that tie is really positive if you're in it. So maybe it's that.
Yeah, maybe. Yeah, because in all of our studies, the spousal tie gets more negative. Yeah, like in the early years of marriage too.
Yeah.
Young?
Hi, Kira. Thank you for the wonderful presentation. I just have a question on your sense of how like the absence of social support as well as social criticism. I'm thinking of like lukewarm relationships. In the worst case scenario, in married couple, people may choose to get a divorce, or in like family relationship. I'm talking about estranged family relationships. So I was just wondering about your sense of how like being in a negative relationship versus that absence of support and criticism might differ in the effects on well-being.
So like looking at low positive versus high negative.
I guess I'm wondering, is it better to be in a relationship that might criticize you and be called as a negative relationship? So is it better to just have a relationship in general than to like not have a close tie?
I think so if you think about it's the worst if you both feel negative. So I think that as long as you're switching back and like my husband always says, only one of us is allowed to freak out at a time. So if you're both negative and you have that there's that negativity escalation model too, that you just like feeding off each other. So I think as long as there's somebody who's counteracting it with less negativity. So yeah, you know what I mean? So if you're both negative and and we found that with the spousal tie in terms of destructive conflict strategies, if you both use destructive strategies, so that's yelling and screaming and things like that predicts higher divorce rates. But so yeah.
Thank you.
Karen Schlag?
Hi, thank you so much for your presentation. I'm really appreciate it. I may have missed this. Did you, when you were, the people you were in your study, were they all living together, or were some of them just close people that I'm close to, but I'm not necessarily living with them?
In the social relations and health study, is that what you mean?
I think,
or which
yeah.
study?
I'm not sure. I think it was the first study you were talking about, I believe.
Okay. Well, so yeah, they're not necessarily living together in the first study.
Okay.
They just fill out that the convoy diagram. Have you heard about that? It's like where they report the closest people in their lives and then less close,
Okay.
less close. So
Yeah.
the first person is the person they can't imagine life without. Necessarily living together.
Okay, I was just curious if that, how that was just a question, but and with your, is it they're reporting relationship quality, or is it more you're having report conflict?
So that study, it was how much do they get on your nerves or make too many demands on you?
Okay.
Negative relationship quality. Yeah. So it's,
Yeah. Okay, cool. Thank you. I think I just missed those details. I appreciate
I
it. Thank
kind of gloss over those things because I find it so boring just to, and then we measured this and then we I don't know, but then it's kind of hard to know what the hell I'm talking about.
you. No, it was great. Thank you.
Thank you.
All right, thank you. Liz?
Hi, I hope you can hear me okay.
Yep.
Thank you. So I had a question about your results with looking at racial and ethnic differences. And I think if I recall correctly, you found that African-American men were more reactive to negative social interactions. Is that?
We found that African-American men had higher heart rate when they had more social interactions. So it was just like the
Right.
number of interactions that they had in the last 3-hour period. And then we
Oh,
found
so
that,
regardless.
excuse me?
So regardless of whether it was positive or negative interactions.
Yeah. And then when we looked at positivity, they had lower heart rate when they had more positive, but we didn't find anything for negative.
Okay, and did you get a chance to get at the type of like who they were interacting with? Was this an EMA protocol?
So the next thing is we want to look more in depth at what could possibly be happening during those social interactions that's stressful. So we do have, we had them do their network diagram. We know who they're interacting in daily life in terms of, are they network people? Are they not network people? We have their race. I mean, and we have anything about those people too. So I think, do you have ideas about what we should look at?
No, I was just thinking also, in addition to who they're interacting with, I guess I would, the location. So is it somebody at home or somebody at work or outside in their community, and how that may.
Out of the home. Yeah, and we also know the race of the person, which I think would be really interesting.
Yeah, that would be good.
Yeah.
Thank you. I'm excited to see what you find.
Yeah, thank you. It's just been a long process of getting that data ready.
Yeah, I understand. Thank you.
So Kira, what do you plan to do to try to figure out what's going on with Black men and their reactivity? Do you have any avenues that you're thinking about?
Yeah, I mean, the one thing I thought that would be so helpful was the vigilance measure. So every 3 hours, we asked them the 4 vigilance items that are, to what extent did you prepare for insults when you left the house today, that measure. And we found exactly the opposite finding, that we found that white people have higher heart rate when they have more vigilance, and there was no association for Black individuals. So that kind of went out the window. So, and so I was thinking looking at the race of the person would help, and the type of relationship. I don't know. I do know how stressed they are in their every 3 hour period. So in terms of, oh, and then the other 2 things I was thinking of, we asked about emotion. So to what extent were you trying to hide how you felt? I was thinking maybe that would be something like that. It's like extreme forms of emotion regulation, not being able to be themselves that would cause stress, like maybe like emotion labor.
Yeah, that fits somewhat with qualitative research that we've done with Black men more likely to talk about needing to get away, find a way to escape uncomfortable relationships.
Uh-huh.
And it's sort of about avoiding the emotions of it, like running from it somehow.
Uh-huh. So, and then are those close relationships or just?
No, those are close. Those are close relationships. Yeah. Are there other questions?
I think Liz Munoz, did you want to ask something or did you already have a chance?
Yes, I asked about the
Okay.
race differences.
Well, Kira, I agree that talks on Zoom are kind of weird, but I thought this went really well. I really enjoyed the talk, and I think we're starting to get used to it.
Okay, thank you so much, you guys, for inviting me.